Is the presentation pulling up now?
Working on it, yeah.
Awesome, awesome. Just making sure. Okay. Well, thanks again, Dan, for putting this meeting together. And just so we're all on the same page here, my name is Tommy Maestas, and I'm the strategic partner advisor for CareerStep, primarily in the Southeast regions of the country. But we have partnerships throughout all 50 states, either through local healthcare facilities or with community colleges or universities, typically in the non-credit continuing education department. I've had the pleasure of working at CareerStep for almost 11 years now, and it's been really incredible to kind of just see how our programs and partnerships have exploded, and really the way that we work with local businesses and community has really grown through those years. And I'm excited to tell you guys about that, what that means for you as residents and members of the Nunez Community College community. So without further ado, we'll just jump right in. So next slide. All right, and so today we're going to cover, our approach to the healthcare education. I want to talk to you guys about the catalog of courses that we offer, and then really dive in and go into details about our world-class learning experience. It's extremely important to us that our students, and we call them learners, most of our partners call them students, but it's very important to us that they experience just a world-class training experience. It's important that they feel well supported and they're prepared to be successful members of the healthcare community. And we feel that it starts with just how they approach their learning. So next slide. All right. And just to kind of reiterate what we do here at CareerStep, we provide an online healthcare education training for people who are training for the first jobs in the field, working to advance their careers, or educating classrooms of potential professionals. CareerStep programs are user-friendly and accredited, so learners can quickly gain the knowledge they need to start improving people's lives, beginning with their own. Next slide. All right, some highlights about CareerStep and just kind of where we've been through the years, what that means for you guys on this call, as well as the community in which you serve. We've been at this for 30 years now. With that being said, we've had the pleasure of training over 300,000 individuals through the variety of courses that we offer. Because of that, we're able to really develop a number of just amazing relationships with both certification, industry partners, as well as the employer partners that are hiring our graduates. As I've mentioned earlier, with our 175 plus academic partnerships as well, it's really given us the opportunity just to learn more about each region, kind of the needs of the healthcare industry, regionally, locally, even down to a city and county level. And, we, use all that information, all of the feedback that we get to continue to improve our programs and improve our process. And ultimately, it's our goal to train each and every individual learner for a job in healthcare. Everything is geared towards that. It's geared towards the job. It's not geared towards passing the certification. I mean, obviously that's important and that's a piece of it, but the whole goal is to get them work ready. And that's what we designed our program to make every individual work ready. And then, for our partners, it's a scalable type of relationship, right? All of our courses are available 24 hours a day, 7 days a week. And we've got a number of resources that support that learning function, whether that be an individual that wants to engage and interact with an instructor kind of during typical business hours, or if that's someone who's studying in the middle of the night because they've got a full-time job and kids and a family they're working to support. So we've got a number of functions to support all modalities. And then my favorite part of what we do here at CareerStep is our employer partner network. Without these guys, we're unable to see our students through to the finish line, meaning employment, right? Without that network of trusted companies, our students would kind of be on their own, and we're happy to say that they're not, right? We are very much a part of that process as well. And I'm excited to talk to you guys about that a little bit later in the presentation and just kind of dive into what that means from a learner's perspective. But that is something that we're extremely proud of, and it's near and dear to our hearts as we continue to train your learners. Next slide. All right, so what do our learners want? And this is something that has really stood out to us. In more recent years, right? We've really done all that we can from an instructional design standpoint to eliminate any unnecessary training that's out there, right? So our goal is to get in, get out, and get working. Our students want to get done as quickly as they can, and we want to make sure that they're prepared to be great, successful employees, and we want to do that in as little time as possible. And so that's everything that we're about at CareerStep. It's going to be geared towards these three things: getting in, getting out, and get working. Next slide. All right, and how do we do that? What are the keys to being able to follow along those functional lines? It starts with the quality, and then it goes to the convenience, and then of course the service. Our content has got to be best in industry, right? So we partner with some of the largest certification agencies to help develop our content. Some of our content is self-created, where we have our own industry experts that put together the material. Others, we contract with industry professionals and experts really in certain fields to make sure that it's the utmost important learning modules, materials, et cetera. The convenience factor is extremely important. All of our courses are delivered online. So they're available Monday through, obviously 24 hours a day, 7 days a week, they're available. And so with that being said, we want our students to feel supported regardless of where they're logging in from. And so that means our Canvas platform supports them to do the learning on a laptop, on a desktop. It's mobile friendly. You can do it on your iPhone or similar device if you so choose. It's not always as great of an experience as maybe on a tablet or the computer, but it is an option. It is possible. If you're picking your kids up from school or whatever that may be, and you got a quick 10 to 15 minutes in the parking lot, you can knock out a couple of the modules on your phone. So that part really plays deeply into the world-class learning experience we speak of. And then of course our service. We want to make sure that we're supporting all of our learners. All of our instructors that engage and interact with our learners are certified in the industries in which they instruct. They've all worked in the field in some capacity, and so they're relying on not only their knowledge from a certification standpoint, but certainly their knowledge of doing the job on a regular basis. Beyond just instructors, we have individual student advocates who are there to answer any and all questions, maybe not content related. So if you've got a question about, maybe Canvas is confusing you for whatever reason, you're not navigating about the program as quickly and efficiently as you'd like, or perhaps for whatever reason your internet may be down that day, whatever that may be, we've got advocates that are there to kind of help support and really just keep you moving along outside of the content material. If it's content related, our instructors are there to answer your question. If you're studying after hours, and when we say after hours, it's after 7 p.m. Central Time, we've got an online community where you can get a lot of your questions addressed during those off times, right? So if you've got a question, we've got an Ask Flex feature that's built into our program where you can log into the CareerStep community, Ask Flex, she's our version of Siri, and she'll spit out the answer for you. If you don't get the answer that you're looking for, you can always email or send a message to your instructor. They'll check that, when they get in that next morning and reply to you. And then, of course, once you complete the program, one of the services that we're very proud of is our career service assistance. So we're going to help, try and connect you through our employer partner network and just make sure that you are aware of all of the work opportunities that are afforded to you through the CareerStep relationships. Now, obviously, there's other employers out there locally, nationally, obviously, who maybe have never heard of CareerStep or don't actively recruit our graduates. We'll kind of help walk you through that process, what that looks like in terms of applying for those jobs, best practices in terms of the interview process. But ultimately, our goal is to put you in front of an employer partner of ours and let that kind of be your next first step into the industry. Next slide. All right, and so, how do we go about doing this, especially as our catalog continues to grow and the healthcare industry obviously continues to grow, and the demand is just continuing to change, right? It's ever-changing environment that we're facing out there. But first and foremost, we always align our curriculum with the career readiness of the position. It's one thing to become an expert by memorizing certain things, but that's not going to help you necessarily do your job, right? You have to be able to understand the curriculum. And
sorry, I'm having trouble hearing you.
Sorry about that, guys. I I actually, I've got my my Apple devices up, and so every time she hears SIRI, she thinks I'm talking to her. I apologize about that. But yeah, so our alignment is career readiness. Has to match up our curriculum. The experience has to be world class, right? We want our learners to really thrive and feel well engaged as they're going through the programs, and that engagement piece is very unique. When we're designing new programs, and our instructional design team kind of puts their paths through, putting them through the Canvas learning management system, we really have a number of different kind of engagement tools that we use to keep the studying fun, right? To make sure that you're comprehending and understanding and learning this stuff as opposed to just memorizing it. So we do that through a number of simulations, case studies, interactive activities, you name it. We try to be creative with how we deliver that content. And then of course the assessment is really important as well, right? As we're, hoping that you're, digesting all of this material and comprehending it and making it part of your normal kind of set of tools. We want to make sure that you truly are understanding the material. So we have a number of assessments that are kind of built into the program to make sure that you're ready for the next part of the course, the next module within the coursework in which you're working on. Next slide. All right, so with all that being said, we kind of talked about what goes into making of the programs. For me, this is an important slide just to kind of highlight what we do as the industry and the needs change. Healthcare is an unbelievable industry to enter into because it's not going anywhere. If anything, it continues to expand, improve, get bigger, more opportunities, more job opportunities, more professional growth. But with that being said, these are 5 new programs we've developed this year, and a lot of this came to be because of the current state of the pandemic that we're all in and we all faced. But we rolled out an infection prevention and control program right when the COVID-19 kind of shutdown happened, and this was a complimentary course that we offered to really educate our community of learners, our community of partners on just kind of what to expect and some best practices to kind of, curtail the spread of the COVID-19. From there, Contact Tracer was the next logical program to roll out. And I don't know if you guys have noticed there locally, but there are just seems to be thousands and thousands of new jobs for contact tracers that are out there. And, I've got a 12-year-old son who's in 7th grade, and the school districts here have been hiring contact tracers like crazy because every time a student is diagnosed with COVID, they've got to let everybody that's come in contact with the student know. And, speaking from experience is, one of my son's classmates had it on the 2nd day back to school. So he got a little 2-week vacation because of that. But that's the importance of the contact tracer role is making sure and effectively communicating kind of the next steps of preventing that spread. And so, that was, just like I said, a logical next step for a program for us to create. From there, Medical Scribe has kind of stood out as kind of the next big push, and that goes hand in hand with the telehealth professions and more individuals that are, not needing to see a doctor on a face-to-face, but they still need to get, meet with them to address certain health concerns. They're doing it, via telehealth systems now. And so we've worked really hard to stand up a medical scribe program. And we're actually working with an organization that's recruiting our medical scribes to work as virtual scribes, right? So a medical scribe working virtually is going to log into their computer just like we are right here. And they're going to sit in on a patient-doctor interaction, whether that be everybody logged in remotely, or even if the patient and doctor are in the same room, the virtual scribe is going to be creating the patient's medical record from afar. And so we're really proud of that training. We're really proud of that partnership that we have with the organization that's recruiting our graduates. And we see that as just a huge opportunity for all of our partners in their communities. They're looking at 150 new scribes per month that they're going to be hiring, at least through this year and into Q1 of next year. So great opportunity. If you know of anybody that wants to work remotely, that's a perfect opportunity. And then our patient care technician was another program that we rolled out this year. And, you know, we're working hard to establish similar partnerships like we have with the medical scribe organization. But one example is we work with DaVita Health, and they host our patient care technicians for their externships. Right. So it's important as a patient care tech that you get some hands-on applicable clinical experience. And so we rely really heavily on that employer partner network to host those. Next slide. All right, and those were, you know, 5 of the new programs that we've rolled out this year, but just know that we've got a number of different professions that we train for, whether it's a medical coding and billing, which seems to be one of the most popular programs that we offer, you know, and a big chunk of that is it's a great paying job. You know, if you think about the amount of time it takes to get in and out of the program, you know, less than 400 hours, and, you know, the median income for a medical coder is about $45,000 a year. It just, the return on investment is incredible. So it makes perfect sense why that one's such a popular program. But we have others that are slowly catching up. You know, we have a very popular pharmacy technician program. It's ASHP approved and endorsed, meaning that upon completing the program, you'll be eligible to sit for the PTCP certification, which in the state of Louisiana, in order to work as a pharmacy technician, you have got to take an ASHP approved program. And so that's one of the reasons why, you know, Dan and Nunez and other academic partners there in the region, you know, choose us to be their vendor partner, is we always make sure what we're doing is relevant to the industries, relevant to the state agencies, the certifying bodies, and that's extremely important to us. But I would encourage anybody on this call or anybody that you may be working with that's unsure of a role that they're looking for, to visit our partner website. It's partner.careerstep.com/Nunez. And here there's just a great deal of information about each one of the programs, but also what to expect in the profession, how much you can expect to earn, kind of what you'll do on the day-to-day basis. It's just a great resource for anybody. So please visit that website if you can. Next slide. All right, as I mentioned, certifications are included anytime it's applicable. So what I mean by that is if it's necessary to work within that industry, we want that certification to be part of your program, right? So that is standard material. So you complete our program, you take our final exam, pass that final exam, and you can take our final exam as many times as you'd like. That's one of the coolest things about learning remotely like this. You know, you'll always have new questions to draw from. We'll show you the answers that you got wrong. You can use it as a study guide, and ultimately our final exam is built for you to become certified. So with that being said, these are, you know, some of the examples of the certifying agencies that we provide the certifications for. Some of the biggest, most respected in the healthcare industry. Next slide. All right, and you know, here we're going to dive into kind of the quality education that builds the employee skills, what that looks like, you know, from a learner's perspective. Next slide. All right, so I mentioned this earlier, but the outstanding content is extremely key for us, right? We're constantly updating our programs to make sure that we're teaching our learners what's relevant in today's environment. We rely on a number of experts to make sure that we're providing that type of content. And so one of the things that's really unique about what we do at CareerStep in terms of just continuing to develop our programs is we have advisory boards and members of kind of each healthcare community, kind of part of those boards, right? So we've got certifying, you know, reps from the certifying agencies. We've got employer partners, whether that's the HR staff or even the individuals that are doing this type of work, right? So like an HIM director for the coding and billing program, as an example. Pharmacists sit on our board for our pharmacy tech program. Things of that nature just keeps us in the know. We're constantly asking for student feedback as well. One of the things that you'll notice if you either A, sign up for the program, or B, if you refer others to sign up for the program, is we're going to start asking them for their feedback almost immediately. You know, within the first couple of weeks, we're going to ask them to kind of, you know, go to Trustpilot and review us, give their, you know, unbiased opinion on what the process has been like for them up to that point. And then we're going to continue along that same pattern and just ask for continual feedback. throughout the program to make sure that we're not missing any steps to ensure that there's not a better way to deliver the content. We've got some of the brightest minds in our instructional design team that spend quite a bit of time, testing out the new methods of delivery and making sure that we're presenting the material, in what they consider the best light. But ultimately, our students confirm that or, give us areas for improvement. And so that's something we're going to rely heavily on. And it just, again, for us, it makes sure that we're doing the best job that we can do. Next slide. And this slide is just kind of an example of, what we talk about when we say, learning or learner engagement or, different sort of activities, interactions within the program. This first, little quadrant with the gentleman facing both frontwards and backwards, that's a hover over tool that we have. Our instructional design team has found that it's a lot easier to memorize and remember and learn the parts of the body as you're seeing them, right? And as you're hovering over them, right? And it's not just necessarily showing you the answer right away. You kind of have to quiz yourself on it and make sure you're holding yourself accountable. But that's just, in our opinion, a much greater way to learn the human body than just memorizing these kind of longer, can be a bit confusing terms. The second slide is another example of that, or the middle of that slide, I should say. And then the other thing that's really cool over there in the right-hand corner, that's our pill counter that's built into our pharmacy tech program. And so as you're preparing to do your externship, if you're going to be a pharmacy technician, one of the things you're going to be asked to do in that externship is to kind of count out the pills and fill some of those prescriptions. And so we want our students and our learners to feel as comfortable as possible as they prepare for those externships. And so we try to build as much of what you're going to do there on site into the program. And then the last example there is just kind of our interactive flashcards. You can customize what you put on these flashcards and how you go about memorizing what you need to memorize. But these are just, some great examples of what's built into the program, in addition to, the rich text, the great videos, and of course, the instruction that you'll get if you call in or schedule a meeting with an instructor. Next slide. We touched about this a little bit earlier. The convenient access is really important, but I just wanted to include a slide to talk a little bit more about kind of the Canvas experience and what that may mean for you. If you've never taken an online training program, this will obviously feel really new. If you have taken an online training program in the past, this will this will also most likely feel pretty new. And the reason for that is we spend a great deal of time arranging and designing how our instruction fits into that Canvas management system. And we want to make sure that the learner experience is truly that. It's an experience that you're proud of, that you're happy to take part of, and it's not a painful experience. We want it to be an engaging, just rich experience. And these are, three of the examples, right, of what it looks like when you log onto the program. You can see there on the computer what that dashboard looks like, what it looks like on your iPad or similar tablet, and of course on your iPhone or similar smartphone. Next slide. And I touched on this a little bit earlier, but really we've got different styles for every learner. We understand that not everybody's going to think the same. They're not going to learn the same. So of course it's self-paced and it's online, but that being said, you can engage and interact with our instructors as much as you need to. There's no set standard as far as that's concerned, other than you engage when you need us to engage with you. So you can schedule one-on-one 20-minute sessions with our instructors. You can do that online through our CareerStep community. You just log in, pick a time on your schedule that works, and then we're going to connect with you just like this here. We've got a number of scenario-based programs and problems built throughout the courses. So, you're not just filling out a multiple choice or filling in the blank, right? Or just taking exams. You're doing the work that you're going to be doing, in your new role. And then one of the most exciting things that we've been working on, and it kind of got tabled a little bit as the COVID-19 pandemic hit us, but we've got a virtual reality component to our learning that we're putting together for those professions that have externship components. we want our learners to feel as comfortable as possible on day one of that externship. Ultimately, we look at the externship as it's a test drive for the employers to learn about you as our student and our learner and prospective employee. And we want you to feel comfortable and feel like you can do a great job from day one. So what we're doing is we're putting together a virtual reality program that's going to actually kind of mirror what you're going to do in your externship. So it's like you'll do your externship virtually before you do it in the real world. Next slide. All right, and then that brings us to our clinical externships. Of course, it's important when applicable that we provide you with a clinical externship. We've got programs such as medical assistant, hemodialysis technician, patient care technician, pharmacy technician. These are all professions that require some hands-on clinical experience. And so it's very important for us to provide that as part of the training that's included in the program. We'll facilitate all of that. I mentioned it earlier, but we've got, a number of partners that agree to host these externships throughout the country and some of the biggest names in healthcare. So, we're happy to say that, even through the COVID-19 shutdown and just kind of the uncertainty that happened with that, for the most part, our externships didn't miss a beat, and we're back placing them pretty much in all areas in which we train. And I know that was a concern that, many of our academic partners had kind of when this was going on is, hey, are our guys still going to be able to get their externships in? And the answer to that was, yeah, we were able to do that. So next slide. All right, and then the last section I want to touch on is the customer support that ensures your success, right? It's extremely important to us that you not only complete the program, but you're successful, right? That helps us to continue to build relationships with some of the largest healthcare systems in the country. And if our students and learners aren't successful enough, they're not great employees, those organizations aren't going to come back asking for more. And we're very happy to report that they come back asking for more. And, we've got each month is kind of part of our division kind of meetings. We always invite back a recent graduate of our program to share their success stories and just kind of what the job search process was like and kind of how they're enjoying their new roles. And it's very, very powerful and impactful to see kind of what that looks like. So on future presentations, I'm hoping to invite local Nunez graduates and newfound employees, in the healthcare industry to take part in future meetings like this, because it's awesome to see. Next slide. I've talked about the exceptional service and I've talked about the world-class learning experience. And for us, it starts with how we engage with our learners from day one. So whenever you enroll in the program, you're going to immediately be introduced to a student advocate. This person is going to be, very similar, to your caddy, throughout the program, right? If you need help with anything CareerStep related, you can reach out to that advocate. It's going to be someone you can speak with on the phone, you can text with them, you can email them, you can chat with them, whatever communication method works best for you. We're going to follow along those lines. If our advocate can't help you, if it's an answer that's kind of out of the scope of their experience, we'll bring on an instructor, right? So we can either, transfer you to one of the instructors if you're calling kind of, Monday through Friday during typical business hours, or we'll certainly provide you with the link to schedule that 20-minute increments with the instructors. Our support agents are there to help with anything, technical related. If you're having questions about logging in, or if there's something going on with the community or whatever that may be, we've got our support agents and our technical support to help with that. And then of course, the career services. These guys are awesome. They're going to help you put your best foot forward when it's time to find a job. That's going to be done in a number of different fashions. One way is through job notifications, right? So we continually have our healthcare partners reach out to our career services team to recruit individuals either on a monthly, quarterly, sometimes a weekly basis. So any opportunity that we know of, we'll pass that along to you. But beyond that, our career services team is going to help you with a resume review, interview coaching, kind of help you along the best practices of finding local opportunities. For every 5 students that complete our program and work for one of our employer partner network individual companies, there's probably 5 others that find local opportunities outside of our network. So it comes in both fashions, and we just want to make sure that you're best prepared to tackle whichever opportunity comes at you first. Next slide. Like I mentioned, kind of throughout the presentation, there's a number of ways to connect with us as a learner. First and foremost, you got the phone. You pick up the phone, dial in the toll-free number during typical business hours, and you'll get your questions answered. If you are the type of person that would prefer just to get your answer, via chat or via email, you can, chat at any time with an instructor via our community throughout the day. And of course, if it's after hours, you can chat in the evening as well. You can ask your question. If it's been answered in the past, you'll get a response. If it hasn't, as soon as an instructor is back manning that chat the next morning, you'll get your answer then and there. And then we encourage you to use email if it's something that requires like a screen share. If you've got a specific question about a portion of the program, take a screenshot, email it into the instructor, and get your question answered that way. But the one takeaway I want to make sure everybody has from this is we certainly encourage as much outreach as you need. Whatever is possible in your learning environment, please utilize it. So don't ever feel like you're calling us too much, or you're using the chat feature too much, or anything like that. That's what it's there for you to use. Next slide. And then here's an example of what the community looks like. I know I've talked quite heavily about it and kind of explained to you ways you can use that, but this is the actual community. So right there under the hello, how can we help you? If you got a question, that's the best place to start. You just type your question in there verbatim and you'll get the answer. If we don't have the answer to it, you'll be instructed to call in or speak specifically with an instructor, and you can see right then and there, you can schedule your times on the computer. You can look at the instructor's availability right then and there. There's a tab to engage and interact with the advocates. There's ways to tour the community. You can get to know the advocates and get to know the instructors on this page as well. One of the cool features that this community has brought to the table for us that we didn't realize we were missing until we rolled it out was that face-to-face engagement and interaction with the students and our instructors. We found that our students really enjoy getting to see the person behind the phone call. So all of our instructors, pictures and bios and whatnot are on there as well. So you can go look and see who you're talking with and engaging with. Next slide. All right, and then I wanted to share this slide just as an example. These are, a handful of the employers that we're continually working with to recruit our graduates as both externships as well as employers. You'll notice two of the bigger names on there, Walgreens and CVS, obviously national organizations. RCM Healthcare Services is another national organization, and they actually lean on us to provide remote coding job opportunities. They're constantly contracting with new healthcare facilities and hospitals throughout the country. And as they add more partners to their network, they reach out to us for more coders to work remotely. Avia Code, another example of a remote coding company that we work with. And then a couple of these other ones, Nuance, Stentel, Emodal, Princeton, 360 Transcription. Those are some of our longest tenured employer partners. They recruit our medical transcriptionists to work remotely. I couldn't tell you the last time we had a medical transcriptionist editor get through our program and actually go on site to work. 90% of that industry works remotely, and our new medical scribe I was telling you guys about, it sounds like that's going to fall along those same lines as well. Just a lot of work from home opportunities. So if that's something that you or anybody that you're helping with, look for training opportunities is interested in, I would say medical transcription editing, medical scribe, and medical coding and billing are incredible work from home opportunities. Obviously, pharmacy technician, medical assistant, patient care technician, those type of professions, you're going to never work remotely in those roles. Next slide. And then I just wanted to share a couple of testimonials for everyone here. The first one is going to be a learner testimonial, and this is Belly, Ryerchuk. My experience with CareerStep has been very positive. From the beginning, everything was explained to me, and throughout the program, all my questions have been answered. The staff that I've had the pleasure of talking to have been very helpful, or excuse me, very pleasant and very helpful. I would recommend CareerStep to any person of any age who is looking to further or change careers. Next slide. And then this is a partner testimonial. And this is Aaron Adams, medical office manager at AHA Healthcare. Every CareerStep learner we've hired exceeds our expectations. They're well-trained, knowledgeable, and ready to work. Working with CareerStep, we've already saved nearly $50,000 in hiring costs. And you go to the next slide, Dan. But I do want to just kind of expand upon that last kind of quote that we had from our employer partner. One of the great things about those relationships that we've grown to have with these hiring partners in the members of our employer partner network is they actually see an incredible value in relying on us to be kind of their trusted training provider. They know the quality of individual that we provide to them every single time, right? Nothing is new. Our training hasn't changed, right? Everybody goes through the same processes, and there's something to be said about that continuity and the ability to expect a certain level of competency. Most of the employer partners, when we first start working with them and engaging with them, some of their initial concerns are, listen, we don't know how to really separate a new individual entering into this industry. Like, how do we know that his training was better through you than it was through the local community college or the local online private for-profit, company or training provider, whatever you want to call them. And, our response to them is always through experience, please give our individual learners a chance, and you'll kind of see what we mean by that. And fortunate for us, our learners do such a great job, and, they continue to build upon that CareerStep brand, and it keeps the employers coming back for more. And it really is monumental when you start thinking about the amount of time, energy, resources that our employer partners are able to save because they're relying on our CareerStep graduates. So it's awesome to know that we're obviously helping to change and touch the lives of our learners, but even, we're making a positive impact on the healthcare industry and how they go about their hiring processes as well. So with all that being said, I'm at the end of my presentation. I'd love to answer any and all questions that you guys may have. So I'll turn it over to Dan and see if we got anything in the chat room, or if people want to just chime in and ask away.
Let me just say before we go back to that, with this healthcare crisis going on, it's impacted so many people, and we've got 300,000 unemployed in Louisiana. And so when I was looking out there for how we as a community college could work to help and solve this problem, I was looking for partners to work with to provide short-term training that led to certification that will allow people to get trained, certified, and get back to work very quickly. And so I learned of CareerStep through its partnership with Louisiana State University and other institutions in our state. So I looked into it. I got to meet Tommy and the team over there, and it was just a fantastic experience. And it's just breathtaking to watch a presentation like this and to learn all of the support services that are in place to help learners as they go through this program, between the dynamic content that's in there, the learning community, the career support services, this extensive partnership with industry players that facilitate the externships for the hands-on learning, and then of course the jobs after we finish the training. So it's just was a no-brainer to get involved. We've already got over 15 students that are working through, and a couple that have already completed some of the programs on CareerStep. So I'm really super excited to have this partnership going on and have this opportunity for people in our community and for people in the state of Louisiana. That medical scribe partner program too is just amazing. 150 new jobs per month going into that program. So just a lot of exciting things happening. So I do see we have one question from Dakota. This is a pretty cool system. Are all the courses on ETP, are all the courses on ETPL? Dakota, you want to maybe clarify a little? I think you can unmute if you like.
I meant, are they all on the eligible training provider list as far as being able to be funded by WIOA?
Yeah, so we submitted a complete list, I think by grid, and all of the ones that are offered from Nunez are on the list. Those that aren't probably in the review process right now. So we've got a number of them that are on the list that I think you'll see now. And if there's one that's missing, it could be that we haven't listed it yet. So, just reach out and I'm happy to work through that process and make sure that it's there and available on the list.
Thanks.
Absolutely. Well, Tommy, I think that the presentation went very well, and I'm hopeful that we were able to communicate the many benefits and opportunities that are available through training with CareerStep and Nunez. Any last thoughts before we conclude?
Yeah, no, I just want to thank everybody for joining us today and let me kind of explain to you what our partnership looks like. And we're really excited to work with Nunez and with Dan. He's been a wonderful partner, getting the programs on that ETPL list so quickly. And to his point, touching a number of new lives already. It's really awesome to see. Once the student completes the program, it's a great accomplishment, and they're extremely proud of themselves, as they should be. But it's really special once you see them get their first job in healthcare, and to know that we're a part of it. It's a really cool feeling, and we're looking forward to kind of building more of those success stories, especially with Nunez. So thanks again, guys, for joining us today.
Thank you, Tommy, for coming and sharing the information about CareerStep, and thank you all for attending. I appreciate it. If you did join us late, I know a couple of people came in after the presentation started. The presentation's been recorded. Reach out to me by email. I'm happy to share that with you. And unless there are any other questions, I think something just came in. Any numbers on learners being hired at our local hospitals? I think that right now we've only had, I think we have about 15 that are in training, and I think one completed training was already working at Oxner. So they were specializing. I think that was, if I'm not mistaken, it was a hemodialysis student. But at any rate, certainly they're looking for jobs at those hospitals, and these certifications are clearly aimed at entry-level positions to make that transition into the allied health industry. So, okay, great. Any other questions? All right, well, I hope everyone has a fantastic day, and thank you very much for attending.